All right. Good afternoon, everyone. Let's get started. Thanks, everyone, for being here today for this webinar presented by Behavioral Economics in Action at Rotman in partnership with the Behaviorally Informed Organizations Partnership. Although we're meeting virtually, we wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. We also stand in solidarity with the ongoing protests against systemic racism and discrimination. My name is Liz Kang, and I am a Knowledge Translation Manager at Bayer and the moderator for today's webinar. We're delighted today to have Dr. Jiaying Zhao, Associate Professor and Canada Research Chair in the Department of Psychology and the Institute for Resources, Environment, and Sustainability at the University of British Columbia. Before I introduce Jiaying, I'd like to go over the ground rules for the webinar. Following this introduction, our speaker will deliver a 30 to 35-minute presentation. And during the presentation, please submit your questions for our speaker by clicking the Q&A tab at the top of or bottom of your Zoom screen, typing into the entry box. And at the end of the talk, and with time permitting, we will have a question and answer session in which I'll select questions from the Q&A tab to ask our speaker. So without further ado, I'd like to introduce Jiaying. Dr. Jiaying Zhao is an Associate Professor and Canada Research Chair in the Department of Psychology and the Institute for Resources, Environment, and Sustainability at the University of British Columbia. Dr. Zhao's work uses psychological principles to design behavioral solutions to address financial and environmental sustainability challenges. Thank you, Jiaying, for being here today, and take it away.
Thank you, Liz. Can we launch the polls?
Sure.
So we have two quick polls for the audience to fill up. This is the first one. Liz, are you, I'm assuming you're moderating the polls?
Cindy is.
Oh, okay. Awesome. Great. So thank you for doing the first poll. Oh, wait. Cindy, can you share the results again? Thank you. So the first question is, how much money do you think should be given to people experiencing homelessness as a one-time financial assistance to uplift them? This is the result of the majority of people select between $4,000 and $6,000, and also between $8,000 and $10,000. Awesome. Do we have the results for the second one? Sorry, this is the second question. So how much would you support a public policy that distributes a one-time unconditional cash transfer of $7,500?
I can see people voting.
Okay, great. Awesome. So here are the results. Wow, the vast majority of people on this webinar support this policy. That's very glad to see that. I've been running this poll around the world. This is a very friendly audience from there. Okay, so thank you, Liz and Cindy, for the invitation. I'm going to start to share my screen. So today I'm going to talk about our randomized control trial in Vancouver that uses a one-time cash transfer to individuals experiencing homelessness in Vancouver, Canada. So I would first like to acknowledge these two wonderful individuals. Ryan Dwyer, who is my PhD student extraordinaire. He's been leading the data collection analysis efforts from this project over the last couple of years. And Claire Williams, who's CEO and co-founder of Foundations for Social Change. Without Claire, this project would not have been possible. In addition, we have Anita Pelip, who is the co-investigator on this grant, on this project with us, as well as a team of amazing interviewers who have been helping us collect data from participants over the last 4 years. Okay, so homelessness is a growing social, economic, and health crisis in Canada. Every day, 35,000 individuals experience homelessness, mostly because of evictions, job loss, domestic violence, mental health issues, and addictions. Every year, about a quarter of Canadians are homeless. This presents significant costs to the government. So every year, each individual experiencing homelessness costs about $55,000 to $130,000 as a part of providing shelters, services, social services, and healthcare, justice services from the government. And for those who are housed, a significant portion of these individuals are actually, precariously housed. They face the risks of homelessness. So that's about 24% of the population. And in fact, one in 5 rental households spend more than half of their income on rent. So this is a devastating picture of homelessness in Canada. The situation is very similar in the US. Every night, more than 500,000 individuals experience homelessness in the US. So, as I said, homelessness poses a significant costs to society, as well as significant costs to the individuals themselves. So, as an extreme form of poverty, there are significant psychological costs as well. So, for instance, our work in the last decade or so has demonstrated that poverty directly impairs cognitive function and elicits a range of counterproductive behaviors that perpetuate poverty. So that makes these individuals even more difficult to get out of poverty and homelessness. So poverty also causes significant stress and negative affect, which can lead to myopic decision-making and risk aversion. So these are the psychological barriers to escaping poverty and homelessness. Now, in addition, the current COVID-19 pandemic exacerbates the risks that these individuals already face. So one of the risks is they face, higher risk of infection due to a lack of safe housing and, lack of social distancing measures. They also face a higher risk of severe cases given the high prevalence rate of existing health risk factors. So this is given their current physical health conditions, and they actually they experience severe cases among this population. And the final risk factor was a higher risk of other harms, such as unsafe substance use and domestic violence, primarily due to the closure of regular social services and health services that they used to access. So how do we combat homelessness? There has been a number of solutions proposed already and implemented already, including emergency shelters and a series of health measures. But the core issue of homelessness and poverty is a lack of cash. So because of that, unconditional cash transfers have been shown to be an effective solution to reduce poverty around the globe. And these studies primarily come from developing countries. So they show that cash transfers improved a range of outcomes, including psychological well-being, health conditions, management with money, food security, investments, behaviors, and educational employment outcomes. A review of 30 studies from World Bank showed that there was actually a slight reduction on temptation goods spending after the cash transfers. So these temptation goods involve alcohol, tobacco, and gambling. So that directly contradicts the prevalent assumption that people in poverty will squander the cash, which is not the case coming from the developing countries. However, these studies primarily focused on low-income villagers or farmers, and no study so far has looked at the causal impact of cash transfers on individuals experiencing homelessness. So this prompted us to launch the first RCT, the randomized control trial, with individuals experiencing homelessness And this is done in developed countries. So we asked, what is the impact of this cash transfer? Specifically, we gave $7,500 Canadian to each of 50 recently homeless individuals in Vancouver as a one-time unconditional cash grant, with another group of 65 individuals as controls. So the reason we chose $7,500 was that it was the annual personal social assistance in British Columbia back in 2016 when we were finalizing the study design. Right now, the cash assistance, the income assistance is about $8,500 per person per year. So the reason we used this approach was that cash transfers provide greater financial freedom. They empower individuals to exercise their own control and choices over their lives in order to propel themselves to move beyond homelessness. So this is an agentic giving model. So after the cash transfer, we tracked life outcomes for every participant over the course of 1 year at 1, 3, 6, 9, and 12 months time periods. We pre-registered a study on open science framework, although this is currently under embargo. So I teamed up with Claire Williams from the Foundations for Social Change to run this trial, which is called New Leaf Project. And our mission for this trial was to empower individuals to move beyond homelessness and improve the quality of their lives. And we recognize that being homeless is a circumstance, not a character defect. And the model guiding our work was believe in someone, and that's still currently our model. Okay, so to make this project happen, we partnered with a number of organizations, including the Ministry of Social Development and Poverty Reduction in the British Columbia government. They granted us a policy permission to let our recipients keep the cash transfer while still being eligible for income assistance and social services, because the $7,500 would disqualify them from income assistance. But we have an asset development account policy in place for our cash recipients to hold the cash transfers while still being eligible. In addition, we also partner with Van City, which is a local credit union, who provided our participants with free checking accounts and ID replacements so that our participants could open checking accounts for us to e-transfer the cash amount to their checking account. And to recruit participants across Vancouver, we partnered with these 4 shelter organizations, and they provided us with 22 shelters across the mainland in Vancouver. So this is kind of a distribution, spatial distribution of our shelters. And we partner with 6 different Van City branches to provide the checking accounts for our participants. Okay, we have a rigorous screening criteria to recruit participants or screen participants. So the first process was a referral by each shelter organization based on these 3 criteria: age between 19 and 65, must be homeless for less than 2 years, and must be Canadian citizen or permanent resident. After that, we deployed a team of interviewers to the shelters where we conducted another screening survey where we screened people on substance use. So to enroll into our study, they have to show no severe levels of substance use measured by DAST-10, which is the drug abuse screening test. And on this criterion alone, 55% of our participants passed this threshold. The second criterion was non-severe level of alcohol use measured by audit, which is the Alcohol Use Disorders Identification Test. So based on this criterion, 87% of our participants passed. And the third criterion was no severe psychiatric symptoms measured by the Colorado Symptom Index. And based on this criterion alone, 74% of our participants passed. So combined, we have which I'll show you in a second, about a third of the participants passing all criteria. So we went into the shelters to do the screening survey under a cover story. This is to make sure that participants will be giving us honest, truthful responses in the absence of any awareness of the cash transfer. We screened a total of 700 participants, and about a third passed all of these criteria. So in total, we have about 115 participants completing the baseline survey. So they are successfully enrolled into the study. So once participants are enrolled, we randomly assign them to the one of 4 conditions. So for simplicity today, I'm going to call group 1 and group 2 the cash group. So each individual in these groups received a one-time cash transfer of $7,500. Some of them also received a workshop, a 1-hour workshop with our interviewers, as well as live coaching. In the other 2 conditions, 3 and 4, we call them non-cash groups. They did not get the cash transfer, but some of them also received the workshop as well as coaching. In addition to the cash interventions, we provided additional non-cash supports, including honorariums for participants completing our surveys, a resource booklet that outlines all the local supports and services available to them, ID replacement services, a checking account, Event City, as well as a used smartphone. So these are all available to every participant in our study. So I'm going to focus primarily today on the difference between the cash group and non-cash group. If time allows, I'm happy to get into the impacts of the workshop and coaching. So this is our participant sample across the period of the study over 1 year. So we started with 115 participants at baseline. At the end of 12 months, we were able to track about 50% of these individuals. This is pretty phenomenal given that they didn't have a stable address. Some of them didn't have a phone because they lost the smartphone we gave them. But even despite these challenges, we're still able to track almost half of our participants. So this is the attrition rate in the 2 conditions over 1 year. This was about 50%. And there are numerous reasons why we couldn't reach our participants over the course of 1 year. The vast majority was simply we lost contact with them. We couldn't reach these participants anymore. A fraction of the participants withdrew from the study, and we also lost a few participants due to death, unfortunately. Okay, so this is our participant sample, demographics of our sample. The average age of our participants is 42 years old. We have about 60% male, 40% female. A third of our participants have children under the age of 19. And we have about 12% indigenous individuals. This is an underrepresentation of the homeless population, and currently in the expansion project, we'll do a better job of recruiting more individuals from the indigenous background. The average duration of homelessness is 6 months. And about a third of our participants didn't have an ID, and about a third of our participants had some form of employment. And this is the reason for homelessness for our sample. So again, the primary cause of homelessness in our sample is eviction, landlord issues, followed by financial constraints. So this suggests that the cash transfer could be an effective intervention for these individuals. Okay, so I'm going to present the results, starting with the positive impacts. So these are the domains in which we see a significant impact due to the cash transfer. We also see null effects in these domains. So I'm going to go over these findings in the next couple of slides. So first, I'm showing the percent of participants in different housing scenarios, situations, starting from baseline to 12 months for the cash and non-cash groups. So this is sort of showing the percent of participants in stable housing. That's their own home, apartment, modular housing, SROs. Temporary housing is basically short-term stay with friends or family, or transitional housing. So they are kind of one step before the stable housing. Institutional housing is treatment centers, hospitals, or prison. And homelessness is in shelter or on the street or sleeping in their own vehicles. So what you can see from this graph was that at 1 month after the cash transfer, about half of our participants, cash recipients, moved into stable housing, whereas only about a quarter of the non-cash recipients were in stable housing. So that result was incredibly fast. This impact was actually well beyond our expectations. And let me further graph the percent of participants, or actually participants still in homelessness as a function of percent of days being on the street or in the shelter. So as you can see from this graph, at 1 month, the cash recipients were able to move into stable housing, move out of the homelessness right away, whereas non-cash participants, stay out of the street gradually over time. So in sum, our cash recipients spent 88 fewer days being homeless. Now, in contrast, this is the percent of days they spent in stable housing. So again, we see almost the reverse trend. The cash recipients actually were able to move into stable housing immediately after the cash transfer. So moving out of the shelter into stable housing provides stability, reduces risk of harm, that includes trauma and violence, and improves health, and frees up more shelter beds for others in need. So that's why this finding is significant. It has a number of benefits. We further tracked their spending. So this is their total spending per month. And what we saw was cash recipients increase their spending, which is great at 1 month. This is their monthly spending breakdown. So a quarter of the spending went to rent, and a quarter went to food, and about another $200 or so went to bills, and then transit, clothing, etc. So let me go into each category in details. So this is the spending on durable goods. They include furniture, computers, cars, bikes, for instance. And our cash recipients will increase their spending on these durable goods at 1 and 3 months. That was great to see. They also increased their spending on rent, primarily as a function of moving out of the shelter into their stable homes. They also increased spending on food, and not just on food for themselves, but also on food for their own children. This demonstrates a positive spillover effect of cash transfer, showing that the transfers not only benefited the recipients themselves, but also their family more broadly. As a function of greater spending on food, more cash recipients achieved food security over time. And this is critical because food security is important for physical functioning as well as mental health. We also see greater spending on clothing. So at 1 month, our cash recipients, were able to basically purchase a new set of clothes, which is great for themselves as well as for their children. So this is another positive spillover effect of cash transfer. So in summary, so far, cash recipients increased their spending on rent, food, and clothing for themselves and also for their family members. Importantly, we did not see any impact of cash transfer on temptation goods. That includes alcohol, drugs, and cigarettes. And this is consistent with the body of literature coming from the developing world. And this directly challenges the widespread misperception that people in poverty will spend money on these temptation goods. Our results, combined with past results, show that this is not the case. They actually did not increase their spending after receiving cash transfer. So in addition to spending, we tracked the savings, and we found that the cash recipients retained more savings over time. And this is important because it challenges the notion of impulsive spending, that people receiving cash transfers on poverty will spend money right away. In fact, our data show that's not the case. They were able to retain quite a bit of saving over time. This degree of savings is also impressive given the high cost of living in Vancouver. So taking everything together, we asked participants, what's the total value of your assets? That includes savings, any financial assets and belongings of yours. And we see that cash recipients showed greater value of assets over time than participants without the cash transfer. Okay, so this is kind of all financial management side. Now I'm going to move into employment. This is the percent of participants who had any form of employment, including part-time or full-time jobs. So as a percent of participants who have any kind of employment, we actually don't see that percent change over the course of 1 year. This suggests that cash transfers may not be the solution for employment, but even given this null result, we see that among the workers basically who have employment, they were able to increase hours of work per week. So this is, cash recipients were able to work more hours over the course of 1 year. This suggests that, the cash transfers maybe alleviated a lot of the burdens of these participants so that they can actually devote more time to jobs. In addition, we looked at per hour. This is among workers only. We found that cash recipients were able to increase their pay per hour at least 3 to 6 months. This is very early evidence to suggest that maybe they got a better paying job as a result of the cash transfer, and that was this could further manifest over the course of 1 year, but we don't have that data beyond 1 year. But regardless, this is really promising to see on employment. For mental functioning, this is the executive function, which is our ability to withhold impulsive responses and hold rules in mind. This is measured by a nonverbal Stroop task. So we see evidence that 3 months that cash recipients improved their executive function compared to the non-cash recipients. In addition to psychological cognitive functioning, we looked at their subjective well-being. This is a combo of satisfaction with life, positive mood, and the lack of negative mood. And for this measure, we see a temporary bump at 1 month for cash recipients, that they improve their subjective well-being, but then over time, we did not see a significant difference between the two groups. Okay, so to capture the costs and benefits of the cash transfer, we looked at the degree to which our participants used social and health services. So this is only on shelter use per se. So we found that our cash recipients actually saved over $8,000 per person per year than non-cash recipients by virtue of their reduced reliance on the shelter system. So this is clearly more than the $7,500 we distributed. And this suggests that the cash transfer can be a cost-effective approach to reduce homelessness, generating net savings for society. Okay, so far I've demonstrated the significant findings from our study. Now I'm going to quickly go over the non-significant findings, the null results. So we did not see any differences in perceived health or in self-efficacy, sense of empowerment, social connection, or fluid intelligence. So these are null results. But again, we did not see a reduction or negative impact of the cash transfers on these domains. So here are some testimonies from our participants on how the cash transfer have impacted their own lives. So this participant mentioned that it has helped them out a lot. It's given them purpose in life and given them hope. It's given them the financial resources to get what they want for their house. So that's one participant. The second participant mentioned that the impact they had was huge. They were able to do a lot of things they couldn't do before. It changed their ability to make proper choices. That speaks to cognitive functioning. If they didn't get the cash transfer, they wouldn't be able to move out of the shelter, wouldn't be able to get their car back on the street, etc. And then the next participant mentioned it helped them solve a lot of issues. Now they have a place, they can focus on getting to school, getting their career, focus on their son. So these are kind of the qualitative responses we have from our cash recipients. At the conclusion of the study, we interviewed all participants, including cash recipients and non-cash recipients. And this is the feedback from cash recipients on our approach. We asked them, would you prefer to receive cash in a different way? And about 40% said yes. So they would like to receive the money instead of, not in one chunk, but maybe in 2 installments. They also prefer to have some guidance on money management, such as having a financial advisor or trustee. So we're actively incorporating these feedback into our expansion project. They did not they told their close family members and friends about the cash transfer they received. And not many people found out about the cash transfer, which is great. That helped protect their safety and privacy. And they also would like to meet other participants in our project that also got the same cash transfer. Okay, so the key takeaways from the study was, first of all, we're working with the most impoverished people in one of the most expensive cities in the world, with the highest rents and the lowest vacancy rates. But even so, the cash transfer increased housing stability, food security, spending, savings, employment outcomes, executive function, and subjective well-being. We did not see an increase in spending on temptation goods. That's a really important finding that we have. So this suggests that cash transfers can be a cost-effective approach, and of course, being an effective approach to reduce homelessness in Canada. So the policy recommendation coming from our study is to distribute a one-time cash transfer of $7,500 to individuals experiencing homelessness without severe substance use, alcohol use, or psychiatric symptoms. So we took this finding and we basically wanted to see how much support we can get from on policy from our study. So we first did a nationally representative survey with people both in Canada and the US. We asked them, imagine somebody got this cash transfer. How much do you think the recipients will spend on temptation goods? That includes alcohol, drugs, and cigarettes. So we framed the recipient in terms of, in their housing status. So we say this recipient is currently homeless, or this recipient is not homeless. We also framed the recipient as someone else, or that's you. You either became homeless or you are not homeless. And you got the cash transfer. How much do you think you would spend on temptation goods versus someone else? And what we found was something quite remarkable, which is that people think if they got the cash transfer, regardless of the housing status, they would not spend, they would spend about $200 from the $7,500 on temptation goods. They also think that, if somebody was not homeless, they also wouldn't spend a lot of money on temptation goods. But if this individual is someone else and is currently homeless, then they actually think that they will almost double their spending on temptation goods. So this highlights the public mistrust of individuals in homelessness in their money management of this cash transfer. In addition to that survey, we ran a second survey asking public support. So this is very much like the poll you did at the beginning of this session. We asked, how strongly would you support a public policy that would distribute this cash transfer to individuals who are experiencing homelessness? We use control group, which is you're basically indicating the level of support without any additional information. We also had two different conditions under the counter stereotype condition, where we told them that in a pilot study, the cash recipients actually reduced their spending on temptation goods and increased their spending on rent, food, and clothing. That's the counter stereotype condition. In the utilitarian condition, we told them that in a pilot study, the cash recipients reduced their reliance on the shelter system and produced net savings for society. So what we found was the following, that the counter stereotype framing and the utilitarian framing increased public support for this policy compared to the control group. So what this suggests was, in order to garner public support for this policy on cash transfers, one, this policy may face resistance because of the mistrust from the public on individuals in homelessness, and specifically on their spending on temptation goods. But to counteract that, we can increase people's level of support by highlighting the reduced spending on temptation goods or reduced reliance on the shelter systems and generating more net savings for society. So that's one kind of takeaway for at least garnering public support. Okay, so to wrap up, we are now expanding this project to other cities in North America, where we're increasing the cash transfer to $8,500, which reflects the current income assistance rate in Canada. Again, we're keeping the two kind of trial, a two-arm design in the RCT. And we're tracking these 6 life outcomes over the course of 5 years. So that's our current plan, in addition to 1 year. 1 year may still not be sufficient to look at, for instance, impacts in employment. Okay, so that's the end of my talk. I would like to again thank my team and our funding sources. And now I would open up for questions.
All right. Well, thank you so much, Jiaying, for this very important work with us. Sharing this very important work with us. So we do have some questions from the audience already, and so let's jump right in. Here's the first question. So how did this project start? So how did you become interested in this cash transfers, or using welfare programs more generally to help combat homelessness? Like where did it start?
Well, it started with the need to address homelessness in Canada. That was a growing crisis back in 2015 and 16. I think something has to be done to address this issue beyond the current, status quo. And then I think I was very fortunate to meet Claire, who founded the New Leaf Project at the time. And we basically, teamed up to design the first RCT and garnered all the resources and funding in place and ran the study in Vancouver. So that's how it started.
Good. We have a couple questions regarding the screening criteria at the beginning of the study. So what kind of research you've based on to kind of determine the screening criteria? And do you perhaps think that the criteria were kind of like strict-ish, so that like only for people who passed this high level of screening were kind of in this, were involved in this experiment?
Yeah, so we developed our screening criteria in consultation with a number of experts on homelessness reduction and our shelter organizations. So we did not just, come up with these criteria on our own. We got the advice that, for instance, we have the 2-year limit of homelessness. This came from Julian Summers, who's an expert in homelessness reduction in Canada. The advice was that you want to look at people who are recently homeless. They tend to have a higher level of functioning, and they're probably most likely to bounce back given the cash transfer. And to mitigate harm and risks of kind of from the cash transfers, we put in place the substance use, alcohol use, and mental health challenges criteria. Again, this is in consultation with the shelter partners who. Well, actually, there's no evidence so far about how this cash transfer will impact people with higher levels of needs. It's an open question. I think to demonstrate, first of all, the feasibility of this approach, we started with this, higher level functioning group to start. But I think, we're in the process of revising that screening criteria at this point to see, maybe other folks in this community can also benefit from this cash transfer. So so that's how we develop our screening criteria.
Great. I have whole other questions lined up. Do you think the cash and non-cash groups in the study seem to coverage at 1 year on housing, employment, etc., due to the amount of the cash transfer? Or do you think 1 year is what it takes to kind of regress to the mean?
I think the cash, so $7,500 in Vancouver is not a lot of money. It's probably sufficient to give you a few months of rent. So it's, but by no means this is a sufficient chunk of money to cover the expenses, living expenses in Vancouver. But I think we are open to other possibilities. For instance, 1 year. One-time cash transfer, maybe followed with a second year down the line. So what I mean is we can see, at least from our data, that at 12 months, the difference between cash and non-cash groups tended to dissipate. Mm-hmm. And that's completely expected because, one, I think the cash transfer of $7,500 is just maybe not sufficient to live for 1 year in Vancouver. I think the number, again, came from the annual income assistance rate in BC, and that has direct policy implications. But in terms of living expenses, I don't think that's sufficient.
Right. Here's another question about the workshops and coaching. I'd like to know more about the role of the workshops and coaching, and also, did you consider a condition without any of these workshops or coaching?
Good question. The workshop coaching worked only for a few participants in our sample. And I have to be, this is where we're very honest. Our coaching intervention was not a success. By that I mean, one, you cannot force somebody to be coached. Two is the level of support that our coaches provided was not the level of support our participants needed. There's a mismatch between the demand and the services we're providing. And three is just our coaches, couldn't even follow up with participants over time, and we couldn't even follow up with these participants because of the lack of contact over time. So for these challenges, we decided not to provide coaching going forward. But the workshop worked for most of our participants, but it was very brief. By that I mean, it was 1 hour with our interviewer every 3 months. So this is the frequency of the workshop, where we went through goal setting, plan making, and self-affirmation exercises. So in the cash group, we did not have a non-workshop condition, and that was because of a demand coming from the ethics committee at UBC. They were against having a cash group with no supports whatsoever. So at this point, I cannot address this, the question of workshop. But in the control group, we did have a group without workshop or coaching. And with that, we were able to kind of compare the two groups and see the effect. And participants, there was actually a slight improvement in the control group from the workshop. So that's the only evidence we have about that.
Got it. There's one person saying, "Thank you so much for your presentation." And I have some questions. So, which external factors could possibly be determinant to get those positive results seen in this in the homeless people? Like, does the level of education have to do, or would there be any other factors that we could possibly think of?
Good question. So these analyses I presented are controlling for age, gender, their level of income before they went into the study, level of education, their previous episodes of homelessness, and whether they're on disability assistance or not. So I have to say that none of these demographic variables were significant in our multi-level modeling, suggesting that at least the effect we see from the cash transfer was not driven by these kind of pre-existing factors. So but I have to say that we have a pretty small sample of 50 cash and 65 non-cash. So I think to be able to fully address, the issue of, let's say, education or disability assistance, we have to have a bigger sample.
Right. Here's another question about location factor. So were there any directional indications of differences of locations in the Lower Mainland? So the map indicated at least three different regions of the Lower Mainland, but there could be variance between locations depending on availability of jobs and costs of transportation and so on.
Yeah, this is you mean this question is looking at the variability within the Lower Mainland, is that right? Yeah, great. So we actually made, this is a great question, but we actually made special efforts to make sure that, we can address this variability, let's say between Vancouver and Surrey, between Vancouver and Burnaby, for instance. So within each municipality, we actually randomly kind of assigned shelters, first of all, to the conditions. So people in one condition would be people from the same shelter would be in the same condition. In addition to that, we made sure that in each municipality, there were shelters in the cash group as well as the non-cash group. So in a sense, we were able to kind of balance these kind of geographic variations across these two conditions. But you're right that there are vast, differences in employment, education, support services, and transportation across, these municipalities. But I think that wouldn't be an issue in our study because we had, both conditions represented in each community.
Right. I think this is going to be our last question. So what happened next after this project or experiment? Like, were there any responses from governments or any other organizations?
Yeah, we actually had a surge of interest from various organizations around the world, and we're now, I think, in the communication with the BC provincial government. We're currently talking to the Attorney General in the BC government about homelessness reduction strategies and expanding our trial in BC. We also had interests from, not just within Canada, but also in the US. We would talk to the Washington State about their homelessness reduction strategies. And they're actually running a kind of a cash transfer trial in the state. We also talked to the government in Scotland. They are, I think, actively piloting a cash transfer trial at this point.
All right, sorry, I lied. There are two more questions here. One person commented, really interesting presentation and incredible work to pull this together. Thank you. Did you account for multiple outcome testing in your analysis?
Yes, we did, because we have multiple DVs, so we would account for multiple comparisons.
Great. Very last question. What were the sources of the funding to provide the $7,500 cash transfer?
Great. So we were successful in a grant application to Employment and Social Development Canada. They gave us $500,000 to start with. Then we fundraised the rest. So total, this trial took about $1 million. We fundraised from various philanthropic organizations and foundations in Canada.
All right. Great, thank you. I think now it's time for us to wrap up this webinar here. So again, thank you so much, Jiaying, for leading our webinar today. Full recording of this webinar will be available on our website, rotman.utoronto.ca/fair. Our next webinar will be next month, April 14th, and we'll hear from Amara Martinez from Western Cape Government of South Africa. Thank you all for attending. Thank you, Jiaying, and you can now exit this webinar by closing your Zoom screen.
Thank you, Liz.
Thank you.